Okay, so with blood pressure, what's too high and what's too low? Right, well, with low blood pressure, you're looking at it being very subjective in that it's really too low when the brain is no longer getting perfused with blood. So you're going to then get symptoms such as dizziness, such as fainting. Yeah, there'd be the main symptoms of low blood pressure. We've all stood up too quick before, and we've gone a bit dizzy, a bit woozy. That's because there's been a lag between the movement, the postural drop, the gravitational pull of the blood, and the heart's ability to compensate for that, the heart and the vascular system's ability to compensate for that. So if you've got low blood pressure, you can feel dizzy quite a bit, you can be unsteady on your feet, it can lead to fainting, it can lead to passing out, things like that. Really, what's too low? Some people could be walking around with a blood pressure of 90 over 60, 90 over 50 quite happily without experiencing any symptoms. But if your blood pressure tends to run higher, you might notice symptoms when your blood pressure gets down to 100 over 60. You know, it's all very subjective. It's what you get used to. You will start to lose a radial pulse at around 80, a systolic, a top number of 80, give or take a little bit, but that's in trauma. You know, if we've got a patient who's experienced some trauma, maybe they're losing some blood, that's a way that we can quickly assess the blood pressure without actually taking the blood pressure, is to feel for a radial pulse. Now, if you've got a radial pulse, you know that blood pressure is going to be somewhere above 80. It's perfusing the extremities. If you've not got a radial pulse, but you've got a carotid pulse, that means that the blood pressure is not quite enough to get to the extremities, but it's enough to get up to the brain. The body's working hard to keep that pressure up to the brain, and that happens at around 80 millimoles of mercury. Now, what's too high with blood pressure? Well, hypertension is defined when the blood pressure creeps up above 140 systolic and above 90. That's when you'd be deemed as sort of pre-hypertensive, like they'd start to take notice. They may even suggest medication. If you're going to see a Western doctor, they certainly will start to get interested in medication around about those numbers. But that's completely treatable with lifestyle at that stage, generally speaking. Certainly, you don't want the blood pressure to be up above the 150 over 100 mark for a sustained period of time, because then you're going to be causing over time damage to the internal systems, damage to the vessels, damage to the eyes, things like that, damage to the extremities. It's also putting strain on everything within the system. It's putting strain on the walls of the veins. But again, they call hypertension is the silent killer, isn't it? Because unlike low blood pressure, where we get to a certain level, we get dizzy and we drop so the body can reset itself. Because if you think about it, if you're standing up and the blood's trying to go uphill, the body thinks, I can't get blood to the brain anymore. The best thing it can do is shut the system down. So then the head comes down so the blood can flow nicely and easily to the head, reinstating the blood pressure. So actually fainting is your body's way of resetting you, of ensuring that your brain still gets its blood and oxygen and nutrients. It's clever like that. But the high blood pressure, certainly if it happens in increments, it can go unnoticed. And you can have people with a blood pressure of 200 over 110, and they might not even be aware of it. Whereas if your blood pressure suddenly shot up to that level due to whatever reason, you'd certainly notice it. You'd be getting headaches, you'd be getting this kind of rushing sensation in your head. So that can be some of the symptoms of higher blood pressure. Can be headaches, can be this rushing sensation. Now, blood pressure, as with your heart rate, is something that's not fixed through the day. So we all hear that the perfect blood pressure is 120/80 or in that kind of region, but it will fluctuate through the day. Like, this is what a lot of people with health anxiety get caught up on, is this fluctuation through the day. Like, they'll take their blood pressure and it'll be high, or it'll be like 140/90, and then they're sort of like, oh my god, I'm immediately going to have a stroke. And then they take it again 5 minutes later and it's going to be up a little bit more because they're stressed, because they're engaging the sympathetic nervous system, this fight or flight response. And then at that stage, it's just a vicious circle of checking it, and then it might go down, and then they might worry about that. So what you have to realize is, in any system, physiological system, flexibility is good. Flexibility is your friend. So we're going to be looking for trends. We're not going to be looking for a fixed number of 120/80 all the time. We're going to be looking for a range of blood pressure. So if you are investigating your blood pressure, it's good to take your blood pressure at different times through the day for about a week, just to see where it's sitting. That way you can get a clearer picture of averages. Now, sustained high blood pressure is going to damage the system. Sustained low blood pressure, like I say, can lead to dizziness, confusion, things like that. But there's a great big range in between. So you do want to see flexibility in the system. It's quite normal to have flexibility in the system. Don't get transfixed by numbers. If you do start to creep into that 140, 145, 150, over 90, over 95, over 100, don't think that you're immediately going to have a stroke. Don't think you're immediately going to drop dead. The body does not work like that. There's flexibility within the system. Yes, medical professionals will start to get interested at that sort of level. Yes, it is necessary to take some sort of action at that level to bring it down, but your blood pressure didn't get high overnight. It's unlikely to come down overnight. Give these things time. It's chronically unchecked hypertension that is going to do the damage over months, years, and decades. It's not getting a one-off reading of a high blood pressure that's going to cause you problems. So try and remove the stress from it. Again, some sort of stress management is very important for maintaining a healthy blood pressure or reaching a healthy blood pressure. Blood pressure medications are extremely effective at what they do. They do carry side effects, but if you are hypertensive and it's uncontrolled, medication for a while is useful. Blood pressure medications are some of the medications that do exactly what they say on the tin. So they're worth taking if you require them. Also, lifestyle. Lifestyle is a wonderful way of manipulating, decreasing or increasing your blood pressure if you need to. Exercise, working that cardiovascular system, eating a whole food diet, reducing the stimulants. If you think about the three factors of blood pressure that we talked about, you've got the pump, you've got the tubes, and you've got the circulating volume. Influencing all those things can have an effect at reducing your blood pressure, bringing everything down. Again, I can't emphasize this enough. You want some flexibility in the system. You want it to be able to go up. You want it to be able to go down. probably the quickest way to increase your blood pressure is to stress about it, is to get worried about it, is to continuously check it. One of the quickest ways to reduce your blood pressure is to activate your parasympathetic nervous system. You can do that within 6 to 10 breaths, conscious breaths of inhaling and then exhaling. Longer and slower than the inhale. This will send a signal to your body that everything is safe, everything is well, everything is good. You're going to flick over into rest and digest, and you're going to relax. So if you're in a doctor's waiting room and you know you get white coat syndrome and you know that tends to increase your blood pressure, just doing some conscious breathing in that waiting room can really help. It's a practical tool that can actually influence your blood pressure within 6 to 10 breaths. So it's worth knowing. So if you're in that waiting room and you're feeling a bit nervous, do some conscious breathing, for a minute, 5 minutes or so before going in, like a mini meditation. And that will generally bring that blood pressure down. Longer term, you want lifestyle change to maintain a healthy blood pressure going forward. And certainly if you're finding yourself constantly stressed, chronically stressed, then perhaps some therapy could be useful to unpick whatever those underlying anxieties are. Because stress is a massive driver of both heart rate variability and blood pressure and metabolic health. When I say driver, it has massively negative effects on your general well-being. So it's worth taking care of stress just to be able to get a handle on the physiology, which is going to put you in better stead. So then, rather than being in a negative feedback loop of stress, increasing blood pressure, worrying, relying on unhealthy habits that are further going to increase that blood pressure, you can start a positive feedback loop that's then going to, reduce your stress, which will reduce your blood pressure. Then you're managing the stress in more healthy ways, meditation, breath work, exercise, which is going to feed into the physiology of making this cardiovascular system more robust, more resilient, more able to cope, which at the end of the day is what we want. I hope you found this helpful. My name's Daniel Wellard from Breath Behaviour Belief. If you have any comments or questions, please do put them in the comments below and I'll speak to you later.